One thing's for certain, the CDC doesn't know what the hell they're doing. Yeah. Let's lock down more. It ain't enough. I want more. I want more orange zones and red zones. I want zones everywhere. Yeah. Well, the shit's getting deeper and deeper and deeper. But before I get into today's little video here on YouTube, I wanted to let you know that in case you missed out on Odysee, there'll be a link in this video down in the description. I did a podcast. It was a live stream. It was 2 hours, 2.5 hours. So if you want to go check that out, if you think I didn't put out enough content, there's 2 hours of shit to digest there. I'm giving you time here and there. I'm not going to crank out these podcasts. I want to give you time to listen and participate and whatever. But I've decided to not take clips from that podcast to put on YouTube because it would be redundant. It would show up also on Odysee, and I don't want to go through that nightmare. So I'm doing little mini stories here for FTM, which stands for Fuck the Media, by the way. So if you look over there somewhere, I'm definitely not a weatherman, but that's my logo for the new podcast. But I'll be using that here as well to do these news, current event related commentary videos. I'm not a journalist. These are opinions. Opinions do not need to be fact checked. We're allowed to have an opinion no matter how stupid we are, no matter how uninformed we may be. We're entitled to our opinion, and then we have a discussion, usually in the comments, on how right or wrong that opinion is, or what I got wrong, or maybe I'm just a piece of shit. These are all useful things that happen, and it's called the dialogue that allows us to, as adults, grown human beings, to make decisions which may affect our lives. I do believe the CDC and government could take a cue from this. So go check that out on Odysee. Also, if you've not signed up for my free email list, I did send out an audio-only version of that podcast. It's too late now. You missed that bus. But if you want to be on my email list for the next one, some people don't like watching long form, but they can listen to long form. I'm going to be sending out audio versions of those live stream podcasts, which, if you want to participate in the live stream podcasts, you can go to DLIVE. That link is also down below. Follow me there, sign up, and participate. We had a lot of fun during that podcast, and I want to keep doing it. And plus, I want to take the time to thank Heidi, who I thanked on that podcast, but I want to thank her again for a generous donation. I also want to thank David MSP is back to support this channel, and I appreciate, the good news is now that I got the part-time trucking thing going, it'll balance out. But I do need to be able to make money on this channel, and these individuals are supporting this so I can keep my content free and not paywall shit, and for those who can't afford to watch or to contribute, leave the commercials running, obviously, for these videos. But then, so on and so forth. Anyways, let's get into it. I've already lost like a bunch of short attention span motherfuckers. So, the CDC is going to shorten the quarantine for those exposed to COVID-19. So all of a sudden, we're changing the rules. And how do you expect anybody to have any faith in you as an organization if you change the rules? That's why no one respects Cuomo. Even lefties are starting to turn on his ass. Is because you're changing the rules, you're making them up as you go along, and there seems to be no good, reason for it. You're using data that is often speculative or corrupt or just completely inaccurate to make these decisions. You've got governors, mayors, etc., all making decisions on this shit based on studies that are just downright shit half the time. If you look into some of them, they're ridiculously manipulated. But I want to demystify that today on this video to kind of show you that we are locking down for essentially no reason whatsoever. We need to start thinking about what we're doing in response to COVID is going to cause us way more damage than the disease itself. We need to think in those terms. And if you're thinking in case rates, which is what the media is and all these lockdown governors are spewing out, is, oh, we got more and more cases, we got more and more cases. But we got to think in terms of the death rates and the chances of you walking around on this earth dying from COVID. And it's a real simple mathematic equation that any one of you can do, but I went ahead and put it together for you in this podcast so you don't have to worry about that. But do your own fucking homework. Don't listen to what I say. Don't listen to what CNN or CBS or all these other motherfuckers are saying, or NBC or, all of these fuckers, because they don't have your best interest. Look at the data yourself and come to your own conclusions. Whether you believe that, like I believe, that it's not lethal enough for us to lock down and stop and get rid of all of our freedoms and erase the Constitution and all the other shit we've been doing, or whether you believe we should all stay in the house and not ever fucking go outside again, not live our lives, not go to restaurants, not hang out with friends, not have people in your house. The list goes on and on. You can't even fucking sing. I went over this in the podcast because I came across it, but apparently in New Jersey, you can't fucking sing in your home if someone's in your household that doesn't live there. No singing. Can't even have a little karaoke gathering anymore in your house. Yeah, I never thought I'd see the day where they're telling you what you can and can't do. That's legal in your own home. These are all things that are legal. Don't come at me with the, well, you can't do this, that, because it's a crime. Well, yeah, but those are laws that have been on the books for a long time. They're not shit that's coming out of your governor's mouth. They're not little edicts and executive orders. Once again, executive orders should not and cannot be law, especially when they contradict the Constitution, which doesn't make any exceptions for pandemics, by the way. But leaving that aside, let's get into this one a little bit. The Center for Disease Control and Prevention is finalizing plans to shorten the recommended length of quarantine to those exposed of COVID-19. The CDC currently recommends that individuals quarantine for 14 days after being exposed to people with the coronavirus. Seems reasonable. If you're sick, if you know you got it, assuming the test is accurate, then yeah, 14 days is not unreasonable. I don't think that everybody should be doing that unless they're sick, unless you have symptoms, because that's when you're most likely to spread a disease, is when you're coughing, sneezing, snot, and wiping it all over the place. That's when you spread disease. I would argue that this disease is a little bit easier to spread than that, but at the same time, it's a balancing act. If you're asymptomatic, you probably have an asymptomatic variant of the disease. So that means if you give it to somebody, most likely they're going to be asymptomatic or have mild symptoms as well. That's how viruses mutate to survive. They don't want to kill us. They want to live with us type thing. So the CDC is always reviewing its guidance and recommendations in light of new understandings of the virus that causes COVID-19 and will announce such changes when appropriate. So that's a nice little blanket rule saying we're going to change this shit whenever the fuck we feel like it. Feelings, not facts. And we're going to do so in a way that benefits the pharmaceutical industry, as we're about to get to. And don't forget who essentially owns the CDC. It's the pharmaceutical industries. Because they also own academia, as we know. But you can go back to some of my earlier videos to look into that. What the eventual recommendation will be is unknown, but CDC Director Robert Redfield said in October briefing that the agency was considering a shortening length of quarantine by up to a week. Okay, what's your justification for that? I mean, that's a pretty drastic change. I feel like in 7-day period, you're still fucking contagious if you tested positive. And that's if you accurately tested positive and not a false positive, of which there are many. We need to optimize quarantine, said Frieden, who currently serves as president of the Global Public Health Initiative, Resolve to Save Lives. We know that the biggest risk from days 4 to 7, after that, the risk is lower. No, we didn't know that. That's changed this whole lockdown zone shit, wouldn't you say? Okay, 4 to 7 days of zone red or zone orange. We're orange zone, by the way, here in New York. So, I mean, it's ridiculous, this zone shit, by the way. I went out to fucking get chicken wings last night. I couldn't eat in the restaurant because the place I went to get chicken wings is an orange zone. My buddy Steve and his girlfriend decided they were going to go to a restaurant. They went up to Liverpool. This is a suburb of Syracuse. No problem. You can sit there and eat all day. Explain to me the sense of this fucking rule. None of these rules make sense. Because if I wanted to, I could have went and had chicken wings, a 15 minute drive with traffic to the other side of town and sat down in a restaurant. Instead, I had to eat the fucking things in my car. You know? But I didn't know that I could go to Liverpool. Now I know that whether or not you're in a zone, it's stupid. And if I'm infected with COVID and I want to go to a fucking restaurant, what's to stop me from going to the orange zone, into the yellow zone, sitting down in the restaurant and infecting everyone in the fucking restaurant? If we care so much about that, I myself think it's, you know, this is endemic. It's going to spread through us anyway. So, by all means, if you're afraid of the virus, you shouldn't be going and sitting in restaurants anyway. It's not like you don't know. How do you not know? Informed consent is what that is. The CDC gave an indication of the changing quarantine strategy on November 20th with its updated international travel guidance. The agency advised international travelers to get tested 3 to 5 days after travel and stay home for 7 days after travel. If the test is negative, stay home for the full 7 days. Without a test, travelers should stay home for 14 days. You know, what this is saying essentially is they're going to test the living holy shit out of you. Tests cost money. Who benefits financially from you taking a test every time you walk into the fucking restroom to take a piss? If you have to test every time you go to a concert, every time you get on a plane, every time you walk in a building, in a restaurant, well, believe me, they're working on that. Every time you have to go to work, every time you leave work, every day you go to work, every one of those tests is money in a pharmaceutical industry mogul's pocket, whether it's from the government through our taxpayers or directly paid for by your healthcare provider. Either way, somebody's making a lot of fucking money off of that test. And if you have to do it every time you do something in society, that has nothing to do with preventing COVID. That has to do with people getting rich. And that is what this will do. This will cause people to have to test to do everything. You want to shorten that COVID-19 fucking restriction? Well, you got to test negative. And in order to do that, you're going to have to take a test every 7 days instead of every 14 days. Or multiple times. If you want to leave your house, if you want to participate in society again, this whole moving of the goalpost shit needs to end. But it's not going to. Biden COVID advisor says U.S. lockdown of 4 to 6 weeks could control the pandemic and revive the economy. Dr. Michael Ulster, whatever the fuck his name is, a coronavirus advisor to President-elect Joe Biden. He's not the fucking president-elect yet, by the way. Hasn't been certified. Not till December 14th, people. And even then, with the court battles, we might not get that. So, once again, the news is not being honest with you here, which is fucking ridiculous. I'm tired of it. Why can't they fucking do their job? I don't know. I don't know at what point the media is going to stop lying to us, but I hope soon. We could really watch ourselves cruising into the vaccine availability in the first to second quarter, so it's all about pushing the vaccine, more money for the pharmaceutical industry, less money for you, more money for them, as you stay home and fucking sit there waiting to be able to do. So let's recap. Pharmaceutical industry is going to be making money off of the vaccine. They're going to be making money off of the fucking test. And in order for you to participate in society in any meaningful way, you're going to have to do both on a regular basis. Yeah, it's not suspicious at all. Osterholm, who serves as the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, yeah, trustworthy place that is, said earlier this week that the country is headed toward COVID hell. Well, if you mean we're going to fucking lock down and do ridiculous, stupid shit to destroy the country, then yeah, we're kind of in COVID hell now. Not because of COVID, but because of stupid fucking responses and lockdowns and shit that we're doing to respond to COVID. That's what's causing the problems. But we'll get into that in a minute, on how little of a problem this really is for us. I wouldn't call it COVID hell. COVID hell is when they're parking the fucking tractor trailers by the fucking next to the fucking hospital to, with refrigerators to fucking handle the overflow of the morgue. That is COVID hell to me. A bunch of people getting sick and have to stay home with their sniffles and then recovering and going back to work. Not necessarily COVID hell. In fact, arguably, if you took lockdowns out of the picture, it would only reduce the workforce maybe 20%, 10% of people staying home because they're sick. Which I believe, that's a nice compromise. If you're sick, stay home, don't go to work. I don't care what it is, sniffle, sneezing, coughing, hacking. I know it sucks. And there should be some kind of program for that. Like FMLA, that kind of shit. I could get on board with that. I cannot get on board with this zone shutdown curfew, can't fucking have more than one person in your house and all this other stupid shit. That I'm not on board with. And it's overkill for what's going on with this COVID right now. Here's another little fucking tidbit, one step towards socialism. We could pay for a package right now to cover all of the wages. Lost wages for individual workers, for losses to small companies, medium-sized companies, because this is doing so well in the previous lockdowns we've had. Now, we haven't seen anybody go out of business, right? Even with the stimulus, worked really well. We could do all of that. You're also imagining a world where fucking the Congress can actually pass a stimulus package to do this. How have we been doing with that? This is what happens when you let ideologues at the university try and come up with fucking policy changes, and then the fucking dumbass leadership is listening to these people. We could do all of that, he said. If we did that, we could lock down for 4 to 6 weeks. So we've actually had a dry run of this, and it didn't work out. People are broke right now. You got people in these zones can't go to work. There's filing for unemployment, and that's the basic unemployment, which will not meet all of their business expense or their living expenses. And where's all this magic money coming from? Did you think about that? You have two options. Either you're going to devalue the currency. See, it always pains me when I see the universities don't understand the fundamentals of the economy, yet some little fucking dickhead like me, uneducated though I may be, or should I say unindoctrinated, I can figure out the way the economy works. There's two ways you get free shit. One, debt. They go into debt to all the way down, they kick the can down the road so that your great-great-great-great-grandkids will fucking pay that bill, if they pay it, during which time there will be exorbitant inflation. Your spending power will be greatly reduced because more and more is going to interests on that debt. Or you raise taxes. What do you think Biden's going to do? He's already said it. He's going to raise taxes. This is assuming he gets into the White House, which I'm hoping doesn't happen. But if it happens, we're fucked. Because he is going to listen to these motherfuckers who clearly don't understand the way shit works. My only point was, if we're going to keep making restrictions state by state, there is no compensation for the businesses that are being impacted. What we're doing right now is not working. And I agree, in your plan, we already tried it. If we do the same fucking thing over and over again, and we get the same result, that's fucking insanity. All right? You can look that up. Look up the definition of insanity. I don't know if that's the real definition, but that's what I think the definition is, and I'm rolling with it. The problem with the March to May lockdown was that it was not uniformly stringent across the country, that it only destroyed the economy in certain places. Well, so we're going to destroy the economy over the whole country, aka Great Reset for the win. So why are we doing all of this? Why are we doing all of this? First of all, I want to state that all of my friends that have been infected are coming out of this quarantine that they've been in just fine, fully recovered. Nobody died. Nobody I know has died, including elderly people who were infected. Supposed to go have Thanksgiving with a friend of mine who him and his family were all COVID positive, have all recovered, including his grandmother, I believe. So that's on my list of shit that's happening. Am I afraid? Fuck no. To be fair, I don't think we're going to have more than 10 people. So, yeah, there's that. But, you know, we'll see how compliant the population is with that whole fucking thing. Consequently, here in the orange zone, you're not allowed to gather more than 10 anywhere, not just at home. So, lines at stores, can't eat in the fucking restaurants, can't go to the gym, can't go to the hair salon, unless your name's Nancy Pelosi. You know, these are all things that are in store for us. So, let's look at the important numbers. The number that the media does share with you is this 257,016 total deaths. This is as of January 21st, 2020. 1,058 deaths over the past week, the last 7 days. As far as infection rates, the Midwest is still the peak area. You know, mostly the red states. All the blue states seem to be doing fine. Does that mean lockdowns are working? No, it does not. It just means a disparity between testing. You know, there's all kinds of ways to manipulate it to make your state look good, which we've seen Cuomo get holes poked in with the press, attacking his numbers as not being accurate. And this is just infection rate per cases per 100,000. And it looks like North Dakota, Wyoming, New Mexico, South Dakota, Minnesota, Iowa, Montana, and Wisconsin, and Utah. Consequently, some of those states are hardcore locked down. Utah is locked down really hard, and I've been there, and they are following it. You know? Yet, you know, if you look into this whole situation, it's a diverse array with exploding cases regardless of lockdown status. South Dakota being the least locked down, along with Iowa in that mix. And then if you come down here, Florida is open, and they're a little bit ahead of New York. Texas, I'm not sure of, but I know Florida, open for business. Governor himself has rescinded all executive orders. So, explain to me how lockdowns work. Just looking at this map. Pennsylvania, lockdown, look at that. And you got to understand, people aren't going to these states. That's the other issue that could manipulate this number. I don't want to go to California. It's locked down. Nobody wants to go to New York. It's locked down. So yeah, that'll prevent some of these motherfuckers in these areas coming over to here. You know what difference this makes in stopping the virus? We're not stopping the virus. We're just slowing down how quickly it runs through us, which means we're drawing out all of this bullshit as long as humanly possible and scaring the shit out of everybody in the process. So let's look into the chances of you. Now, the way to arrive at this number is quite simple. How many motherfuckers are dying, both in a weekly basis and nationally, out of the population in general? This is a number that will statistically determine your percent chance of dying from COVID-19 living your life under the current circumstances, wherever you may be. This is an easy number to figure out. You know, you could do it with fucking elementary school math. And turns out that's what we should be doing to make our decisions, because when you cloud the numbers with a whole bunch of horse shit, there's a chance that you're probably fucking with the numbers. So there are currently 330,634,000 and some odd, it's constantly ticking, people in the United States. Of those people, since the beginning of COVID, 257,016 people have died. Sorry for your loss for those of you who have lost somebody, but people die all the time and have been. By the millions, by the way. If you look at all-cause mortality in the United States this year, it's in the 2 million range. Don't see us shutting down all kinds of other shit for that. When 257,000 people die out of 2 million deaths dying from COVID, but we do nothing about the other, 1.75 million people that have died, yet we're doing all this extreme shit for this smaller proportion of that, doesn't make sense to me. I tend to err on the side of live your life and take your chances, but I guess people don't think that way anymore. Maybe I'm old. I don't know. But that being said, not a lot of people dying, percentage-wise, from COVID-19. So let's look at the math. So your chances of dying from COVID throughout the whole pandemic so far, based on just being alive and walking around the United States, wherever you may be, is 0.077% chance of dying from COVID-19 in the United States. No matter where you are, who you are, what you're doing, what you're not doing. We've seen it all. This is all the lockdowns that have been going on, all the mask shit, all of that shit is factored into this number. This is what we've been doing so far, and 0.077% of us have died. That's a very, very small, low percentage. Probably got a better shot at some of the lottery. You got a better shot at walking out of the casino a millionaire. 0.077%. And we're destroying our way of life. We're removing our freedom. We are not going to work. We are destroying everything for 0.077% of us. So you would think, if that's the average, how are we doing the past 7 days? So I came to that idea. 0.00031% of the population died last week from COVID-related deaths. And we can get into the disparities in that another time. But we're just doing some basic numbers here. So now we are far below average way below average in our death rate right now as of the last 7 days. We are below average. If it had ticked up, this number would be the same as this number or higher, because we would be at average or above average. But we are far below average, yet we're locking down again. Explain to me how that math works. I don't get it. How does that math work? How do you justify this? If I can sit here and suss this out in an hour on the internet, who the hell's running shit? Who's in charge? And why are you making these decisions? I don't fucking get it. So now you have way less than 1% chance of dying from COVID during the last 7 days in the United States. Yet we're locking down more. We got curfews. You can't sing. You can't dance. You can't go out. You can't stay in. You can't do anything. You can't have your friends over. You can't do anything except watch the news and be scared and stay home in your house and go broke. Those are your options. And you will. They ain't going to fucking give you that kind of money. They ain't going to give you the money that you could be earning if they lock you down. And, you know, now some people are not unaffected by it. Congratulations. You're in an industry that's essential because you're working for the bigger corporations that are benefiting. But there's a large portion of the population that works for small businesses and entrepreneurs who are being decimated by this, with a far less than 1% chance of dying from COVID. And that's regardless of the things that they're preaching right now. That's regardless of the case count, which is spiked way up. Which is why they're trying to panic you, is how many cases. We got 12,333,452 fucking cases of this virus. Now, there's another math thing you could do to figure out the percentage of deaths for that, but that's not accurate because you do not know the actual case count is higher than the 12,333,452. Those are people that got the test and tested positive and were recorded into the system. Joe Blow, who doesn't believe in getting tested, and there's a lot of us, by the way, is living their life. They get COVID, they're asymptomatic, they have mild symptoms, or maybe they get downright sick and just stay home on their own. But they don't ever go into the medical system. This number is far higher than that. But this is the number they have. So if you were to divide that by the fucking deaths, you're going to get an inaccurate mortality rate for the virus. You have to extrapolate from the population based on the data. You'd have to have the total number of tests done versus the total number of positive tests. And that gives you a positivity rate. Then you can extrapolate that to the entire population of the United States. And then you divide that number by the deaths and you get an approximate, but not 100% accurate fatality rate for COVID. And if you do that, I believe it's somewhere like less than 1% or at 1% for elderly people. But we don't know that because elderly people can recover from this as well. And they aren't lining up to fucking get stuck right now. Just saying. So the moral of the story is, this is all being done to control you, to reset the economy, build back better, to benefit large corporations, particularly the pharmaceutical industry, who stands to gain trillions financially from the vaccine and from the testing alone, not to mention the other treatments involved. There's a huge financial motivation for us to be dealing with this as long as humanly possible. People are going to get rich while the rest of us suffer and poor. It is a transfer of wealth that will continue. That's why you hear a great reset bandied about here and there. It's a legit thing. Look into it. Look up Klaus. and the Great Reset, and preferably a non-Google fucking search algorithm like DuckDuckGo, and then start looking into it. And you'll find that there's significant evidence from powerful people who are on board. You've seen it pop up here and there on Facebook, on YouTube as well. They aren't looking at stopping the virus. They're looking at not wasting the opportunity to change our way of life to a more socialist, to a more, a less free society where you don't necessarily own a lot of shit, where you rely on the government and universal basic income to survive, essentially transferring the wealth from the middle class to the wealthy and leaving all of those people to go poor. And the ripple effects, as quoted by the World Health Organization, will span the world, and millions of people will starve to death because of that lockdown, especially if the Biden national lockdown goes into place. You'll have people starving to death here, but there's countries whose entire economy depends on us. Their entire existence depends on being able to export to us. And we're going to destroy those economies, because while you're at home, unless you're buying shit off Amazon, but you ain't going to have a lot of money to buy shit off Amazon, that's going to have a ripple effect. You got to understand, we're all in this together economically. And while you're protecting yourself from something that has less than 1% chance, far less than 1% chance of killing you currently, you're destroying the lives guaranteed of millions of people around the world. Yet I'm a selfish asshole. Sorry, but if you're thinking lockdowns are virtuous, you're destroying lives. Stop it. Just stop it. Say no to this shit, please. I'm not an expert. Don't do everything, but do your homework on this. Do the math. Figure the math out. If you can't figure the math out, use calculators. They're all over the place. Figure out the percentage of people that are dying. Come to your own conclusions. And if you do this and you aren't doing it in a biased way, you'll be able to figure out how to best control COVID. Take precautions on your own, of course, but lockdowns and mandates are not the way to go. In fact, I would argue that even if we lifted all the lockdowns and mandates, there's still going to be a severe economic impact, because people are still going to be afraid of the virus and they're not going to participate in the economy anyway. But when you add lockdowns to that, you're forcing people who otherwise would go to work and take their chances, or who would go out to a bar, or who would go out to a movie theater, or who would go out and do all of these other things entire industries are built around. You're taking the people who would choose to do that out of the mix when you introduce mandated lockdowns. I've always said you have the ability to control your risk level. You can stay home. You can do whatever the fuck you want to avoid the virus. You could wear full PPE, face shields, you've seen it. You've seen it out there. There's people who are scared enough to put the face shield, the masks, and have a mask on under the face shield, and the fucking gloves, and plastic garbage bags all over the place. I have no problem with that. Do you. I have a problem with governors and presidents-elect wannabes telling us what the fuck to do. That's what I have a problem with, and it needs to stop before it's too late. Because there is a tipping point, people, where if we do that lockdown, if that lockdown that Biden wants, or should I say all the people talking in Biden's ear, and he's just like, yeah, he's like a puppet, If that goes through, that may be the tipping point for the economy that will launch us into a multi-year Great Depression that will destroy and kill millions of people around the world. Let's not do that. It's really simple. You say, that looks like it sucks. Let's not do that. But what the fuck do I know anyway? I'm not an expert. I'm just a fucking asshole. Please like and subscribe for more shit, and I'll make more shit. If you like this video and you want to help support and compensate me for the time I spent making this video and many other videos to come, or maybe videos in the past that I already did, please head to ScottTheTruckDriver.com and leave a tip in the virtual tip jar. There's PayPal, there's Bitcoin, and there's my store. You can just do all of that there. Also, if you're not following me on Odysee, I do post my new FTM Fuck the Media podcast on Odysee going forward. If you're not following me on DLIVE, you won't be able to participate in those live streams. And the reason those live streams are on DLIVE is I can talk and not worried about getting censored. Same thing with Odysee. That's where I'm, you want to see me at maximum fucking triggered? That's the way to go. I'm already skirting the line with this video. This video might be fucked. I don't know. I just am giving you guys a video, not because of whether or not this is going to do anything for my YouTube channel, but because of the support of others that they have, financially contributed. And I feel obligated to put out the extra work, even though YouTube's probably going to wipe its ass with this video. At least it's there. That's not my fault if you can't find it because of Susan. So follow me over there. Subscribe to my free email list for audio files. It's absolutely free. You just sign up for the email list, and then you get the next email, and there'll be audio from the next podcast as it comes out. And I'm thinking of other goodies, because I am into other things that I might send out. Maybe I'll send you a royalty-free song here and there. Who knows? I'm working on it. I'm growing. I also got to redo my website a bit. Once I get that all done, then I'm going to start working on memberships here on YouTube, but that's kind of low on my priority list because I don't know how long I got on YouTube with the way things have been going. We'll see. I'll keep chugging along till Susan smacks me with the hammer, and then that's that. So yeah. Have a nice motherfucking day and shit. And stop being scared to live your life. We all take risks. I'm about to take a risk going to work part-time next week, by the way. I'll be back on the road for 6 days, somewhere in there. And then, continuing the part-time gig. Everything's working out as far as all of this coming together between people supporting the channel and being able to part-time truck. I should be able to do semi-full-time content creation. A little harder to do on the weeks that I am out there trucking. So those will be sparse video and podcast weeks when I do that, because I'm going bare minimalist when I go out. But, thank you. And for those of you who I didn't mention as supporters, I want to thank you too. There's a bunch of people that contributed during the podcast on the live stream through DLIVE, which does have a way of contributing there. There's people that have contributed on the premieres. And I appreciate all of you for helping keep this going and making it worth my while and worth my time. Because how I am. I don't like wasting time. And sometimes when I post on YouTube, and Susan pulls the plug on a video, and I'm just like, well, there's time I just wasted. I don't like that. I'm a fairly skilled, productive individual. I could make money in other avenues if I were to dedicate my time, but I don't want to have to do that. I like, the discussion. I like the debate. I like that I'm not the only one thinking this way too. There's a lot of you because if you look at other places like the media or Facebook or any of these other fucking places, chances are you're going to feel like you're alone in the world. And if you agreed with what I said in this video, at least you're not alone. And for some, including me, that's enough to keep you going. So, all right, I'm out. Have a nice fucking day and shit. Stop worrying. I know it's hard to do when you can't even fucking sing in your house. Fucking. And I'm in an orange zone, which means I have to drive across town if I want to do anything. It's a little inconvenient. Unless that becomes an orange zone. And then it becomes red. Don't think I don't know what you're doing, Cuomo. I know we're gonna be fucking red in no time, you fucking filthy piece of shit. I want to rip both your nipple rings out and smack you in the eyeballs with them, motherfucker. Quit destroying us. Quit it.